There are three specific types of soft tissue injuries that we want to address, because they're slightly different in how we manage them than just a regular cut or abrasion or avulsion. These are burns, blisters, and frostbite. Let's start with burns. There are different ways that you can get burns. You can have chemical burns, thermal burns, electrical burns. In the backcountry, typically they're thermal burns. We get burns from hot water or maybe a fire, something like that. When we think about burns, there's a couple of different evaluations that we need to make. We need to think about the type of burn, we need to think about the degree of burn, and we need to think about the extent of the burn. We talked a little bit about the type of the burn, and as I said, in the backcountry, they're typically thermal burns. When we talk about the degree of the burn, we have three levels. You may have heard about first degree, second degree, or third degree. We try to stay away from those terms now, mostly because no one could remember which was worse, first degree or third degree. What we call them now are superficial, partial thickness, or full thickness burns. Superficial burns really are sunburns. They look like sunburns. Your skin is red, it's angry, it hurts, it's hot, it's dry. Those are superficial burns. There is no life threat in a superficial burn, at least right now. If you keep getting superficial burns, you're going to end up with skin cancer, but immediately there's not a life threat. So how do we manage superficial burns? Well, aloe is your best bet. Simply put aloe on it, it will cool it down. Keep your patient hydrated because your skin actually helps regulate the water balance in your body. And with a burn, it's going to have a hard time doing that. And that's it. So now we move into partial thickness. How do I know a burn has gone from superficial to partial thickness? It's the formation of blisters. Once I have blisters from a burn, I'm in partial thickness. It means that the burn, the heat from the burn, has moved deeper down into the tissue. At this point, more burning action has occurred deeper into the body. Your tissue can actually hold heat really well. This means in this type of burn, we need to remove all the heat. Now, if any of you have ever grabbed a hot pan off the stove and burnt your thumb or your finger, it hurt. You went to the sink, you put it under water, cold running water, for maybe 10, 15, 20 seconds, and then it just got cold and you were annoyed at having to stand there, and you took it out. And if you noticed, 2, 3, 4, 5 minutes later, all of a sudden it hurt again and there was a big blister forming. That's because you didn't get the heat out of the skin. You need to cool these things off. It doesn't have to be ice water, but you've got to get this in something cool that will withdraw all that heat. A good 20 to 30 minute soak in cool water will help remove all that heat. Now that heat's removed, now I can address the injury. I want to make sure that I have any restrictive clothing or jewelry removed from the area, because burns have a tendency to swell depending on how bad they are. And then I'm just going to treat it like a wound. Simply going to make sure that I dress it and bandage it. We're not going to scrub these. We're not going to pop these blisters. We're going to leave everything intact. With wounds from burns, the problem that arises is fluid imbalances and infection. If I pop any of these blisters, I'm going to make this thing open to infection. So keep everything intact, wrap it up, and then we're going to think about evacuation. But that has to do with how much of the body is burnt. We'll get there in a moment. The last type of burn is a full thickness burn. This means that the heat from the burn has moved all the way through the tissue. You may have burned all the way down into muscle, down into bone at this point, depending on the type of burn that you get. All of these burns will be evacuations, no matter how big they are. All full thickness burns are going to be evacuated. How do I know I've had a full thickness burn? Well, these type of burns are going to be insensate, meaning where there's a full thickness burn, there's no pain. This does not mean the patient will be without pain, because surrounding this full thickness burn will be partial thickness burns. So there will be a lot of pain. You will also possibly notice charring, depending on the type of burn that it is, or leathery type skin. Full thickness burns are truly dangerous. How am I going to treat them? Again, just like a wound, but we're not popping things. We're not going to scrub it. We're simply going to remove the heat and then dress and bandage it and then evacuate it. Now, let's talk about the extent of the burn. There are lots of different ways that we can estimate the extent of a burn on a patient. I'm going to give you the simplest one. If you look at your palm, the surface area of your palm is 1% of your total body surface area. So if I have a patient who has a burn, I can use my palm as a rough estimate to say 1, 2, 3, 4, about 4% of their body is burnt. Why is it important to get a percentage of the body surface area that's burnt? Well, that's going to help dictate my further actions. Do I need to evacuate? Can I keep going? Those types of things. So, when do I evacuate burns? Well, we already said all full thickness burns, regardless of the extent, are evacuated. Any partial thickness burn that covers more than 15% of the body surface area should be evacuated. It doesn't mean you need a helicopter, but it does mean you should be moving to the front country. Any burns that involve the airway. How do you know you have an airway burn? Well, you might notice soot or a dusky appearance around the nose and the mouth. These are truly life-threatening emergencies. If your airway gets burnt from inhaling hot gases, that airway is going to swell, close off, and there's nothing you can do about it. Any burns, partial thickness or above, to the hands, the feet, the face, or the genitalia require evacuation. It doesn't mean they're life-threatening burns, but the problem with burns to those areas are those are necessary for everyday normal function. And burns require specialized care. If I prolong care for burns to the hands, the feet, the face, or the genitalia, it can have lifelong consequences, so I want to make sure that they get the proper care. Let's talk about blisters now. When we're talking about blisters, we're not talking about the blisters that form from burns. I'm talking about friction blisters, the ones you get in your shoes when you're hiking, the ones you get on your hands when you're paddling, those type of blisters. Not a lot to talk about here except what we want to do, because there are a lot of different theories about what to do for blisters. The first thing, don't get a blister. It seems obvious, but that's the thing you need to do. Don't get a blister. Wear boots that fit properly. Keep your feet dry. Take rest breaks, take your boots off. My advice is wear liner socks. It's one of the best things you can possibly do to prevent blisters. Liner socks are simply a very, very thin sock that you wear on your foot, and then you put your hiking sock over that. What it does is it creates a very slippery surface, and you won't get friction blisters. But whatever your preferred blister prevention method is, go for it. There is one thing I'll ask you. Do not use duct tape to prevent blisters. Why? Tape is great. Lots of people use tape to prevent blisters. Use medical tape. Use tape that was meant to go on skin to prevent blisters. Don't use duct tape. But now you have a blister. What am I going to do? Well, the question arises, to pop or not to pop? Lots of people, lots of opinions. Here's the right one. Pop it. Why? Why do I want to pop that blister? Well, you all know the blister is going to pop eventually. It's going to happen. If I pop it, I can control when it pops and how it pops. I don't want to be hiking along and have a blister explode in my boot. What have I done? I've now created an open wound that's very prone to infection. It's also extremely painful. I want to stop, take my boot off, find the blister, and then just simply put a small pinhole in it. Drain the blister out. Do not remove that flap of skin. Keep it intact. And then simply put on whatever blister prevention method you prefer. Besides liner socks, once somebody has a blister, I've popped it, my preferred treatment is again that Tegaderm. It's breathable, so it allows the blister to dry out, but it's super slippery, which means there's no friction. But you can use whatever it is you prefer. That's it for blisters. Lastly is frostbite. Frostbite is just like burns in that there are levels and there's extent. Frostbite can happen even when it's not freezing temperatures outside. If you have poor circulation or if you have uninsulated extremities, you can get frostbite in above freezing temperatures. We have superficial frostbite. This used to be known as frost nip. If you have ever been in a cold environment, you've had superficial frostbite. This is when your hands or your nose or your ears get a little numb, a little tingly, a little painful, right? But everything is still squishy. What should you do in this case? Well, you should recognize that it's getting cold and you need to get out of that environment and you need to warm them up. But don't do what we all do. You're in a cold environment, you're clearing snow off of something, your hands get a little tingly, a little painful, you come inside and you put them under hot water or you put them over the hot stove and it hurts. You're screaming, but then it feels so good. Well, then you look down at your hands and you notice there's all these little red dots all over the place. That's called petechiae. What those red dots are the exploded ends of your capillaries. What you've done is by getting cold, your vessels vasoconstricted. They pulled away and got really small. When you came inside and put them under really hot water or over a really warm temperature, all of a sudden they expanded rapidly. But the ends of your capillaries couldn't keep up. And so all this blood came at them and you blew them up. Why is that bad? Well, what you've done is destroyed your microcirculation. Every time this happens, every time you get an isolated cold injury, a frostbite injury, you become more prone to it the next time and more prone the next time because you're destroying the microcirculation that's bringing blood out there. So what should you do? Put them in your armpits. Put them on your stomach. Put them on a friend's stomach, right? Gentle rewarming. That's it. Now we move beyond superficial frostbite and we moved into partial thickness. Just like with partial thickness burns, we've now gotten freezing that's moved down the layers. As the water in our cells starts to freeze, it forms crystals. Now, crystals are sharp, pointy things. This is important to remember. These are freezing. We've got to stop this from happening and hopefully reverse the process. How do I know I've moved from superficial frostbite into partial thickness? Well, you're going to notice that the skin becomes much paler. It's almost sort of waxy looking. You might even notice that some of the pain has started to go away. But the key here is it's still going to be squishy. The skin is still going to be pliable. If this happens, I need to rewarm these. This can be excruciatingly painful when it happens and in the rewarming process. Just like with burns, I need to remove any restrictive clothing or jewelry. As this rewarms, it's going to swell again. Now the crystals, why did I say we want to remember that? We want to remember it because you never want to rub cold body parts. If I have frostbitten hands and I start rubbing them together, what am I doing with those crystals? I'm shoving them into the walls of the cells. It's bursting the cells and causing more cellular damage. We never rub cold extremities. You can shrug your shoulders, you can use centrifugal force, but the best thing to do is gentle rewarming. You can do skin to skin, you can do nice tepid water, circulating, something you would put a baby in. This is going to slowly rewarm these and allow the circulation to return. This will be painful though. Once you get it rewarmed, now figure out why it got cold in the first place and prevent it from happening. Now I move into full thickness frostbite. At this point, we've frozen all the way through. We've frozen tissue all the way down. You might be trying to picture in your head what this looks like, and perhaps you're picturing folks on Everest. You've seen their fingers have turned all black or their nose has turned black. That is not what this looks like. All of those pictures are after the body part has been rewarmed. What you're going to see is that these are going to be pale ghost white and they're going to be hard. Think of it like a block of wood. The reason is this is completely frozen tissue inside of here. These aren't painful at this point because it's completely frozen. You don't know the extent of the damage until after rewarming. Just because you get something that is full thickness frostbite doesn't mean you're going to lose it. It's a possibility, but it doesn't necessarily guarantee it. Well, what am I going to do in this case? The trouble with full thickness frostbite is if I rewarm it, I must ensure that it never freezes again in this particular time frame. Because it's worse to thaw something out and let it refreeze than it is to just leave it frozen. Imagine it this way. You go home tonight and you're going to take a steak out of the freezer and eat it for dinner. You let it thaw on the counter. But at dinner time, you decide you don't want steak, so you put it back in the freezer and it freezes again. The next night you say, I'll have steak tonight, so you take it out. And you repeat this process 2 or 3 days. Well, by the time you finally cook that steak, you're going to notice it's what? Freezer burnt. That's what's going to happen to your fingers or your nose or your ears. Once this thing is frozen, if you cannot guarantee that it will stay thawed, leave it frozen. The other thing to think about is if it's the feet or the toes, if I thaw this out, they're not going to be able to walk on it because it will be that painful. And if I need to evacuate this patient, the best way is walking. Leave it frozen, have them walk out, and then we can manage it. However, if we do decide to thaw this, warm circulating water is your best guess. That's what you can do. About 30 minutes in that, but it's going to be very painful, very painful. There are some other things that you can do for this. You're going to dress it and bandage it, protect it. And if you happen to have aloe with you, you can soak those dressings in aloe before you put it on that frostbitten injury. What aloe does is it has antiprostaglandin effects, meaning it's going to prevent some of the swelling. The other thing you can do is perhaps use aspirin if your patient isn't allergic. Aspirin may allow blood to flow through the frozen capillaries to provide a little bit of blood flow, a little bit of circulation to get out to that tissue. But full thickness frostbite requires expert care.